Hi, this is Javier once again. Today we'll be discussing one of the most important, if not the most important part of the phlebotomy course, which is the venipuncture procedure. This is in chapter 8 of our textbooks, and follow along, please, as we go. When we perform the venipuncture on a patient, it becomes so automatic that many times we forget to understand the rationale of the procedure itself. So in this chapter, we're going to cover every single step and why we cover it this way. Again, these are through the CLSI guidelines that we'll follow, and that should be your utmost important document. If you ever have any questions about the procedure, the CLSI guidelines would be the one to refer to. So before you even start the actual puncture, okay, before you go and approach the patient, you must have a document that validates or the request from the physician. So when a patient goes to their clinic, to the doctor, right, and many times the doctor will give them a small script, like the one for medications, and in there, in the prescription, you'll have the patient's name, their date of birth. You're going to have the labs that are requested, all right, and along with that, usually they will have a diagnosis, or what is the why, or what is the reason the doctor is requesting this specific lab. So they come into your office and they hand a prescription. Here I am. The doctor has ordered some lab work. Okay, great. So if you're in the front desk of the laboratory, you take this and you're going to ask the patient to fill out a requisition. Okay, so they brought you a script. Now you're going to ask them to complete a requisition. We'll give you a sample of what it looks like, and they come in many different forms. These are manual ones, right? Now there are some that are electronic, but at this point, we're talking about manual requisitions, all right? So when the patient, you hand the document to the patient, you're gonna ask them to complete everything, including their demographics, their complete name, their address, their insurance information, their date of birth, certainly, all right? And but you as a phlebotomist are responsible to make sure that that form is complete, okay? It's not the patient's fault if it's not complete. So you have to verify. You're gonna go look at the form, all right? And you're gonna look at the date the doctor wants the labs done, because it doesn't necessarily have to be that particular day, right? The patient may be confused or not understand. The doctor just gave prescription, so they head out to the lab, all right? Now they're in front of you, and you're like, ma'am, this is scheduled for, a week from now. Okay, not a problem. You instruct the patient on the procedure, but at least you're going to schedule it. Okay. So again, it is your job to make sure that you know the time this lab is supposed to be collected. Okay, that means a priority. All right. Uh, you make sure that the doctor's name is on there. Okay, the diagnosis that was on the script. All right, and of course the labs that need to be collected, along with the insurance information. So this information has to be in what we call the requisition. All right. Without a requisition, technically there is no blood draw. Okay, you cannot perform a blood draw without a requisition. Why? Because legally, this document is the one that will back you up in case there's any problems. All right. So the requisition has to be completely filled out. And you're responsible to ensure that it is completely filled out with all the information in it. Okay. The type of the test, the date the test is to be performed, billing information, the test status, whether is it time test or is it fasting. All right. Any special precautions, maybe the patient's allergies to something, to latex or something else. Obviously, the patient's date of birth has to be there, the doctor's name, and the first and last name of the patient. Okay, very, very important that you make sure that all that information is in the requisition. So again, without a requisition, there is no venipuncture. Okay, very good. Now, like I said, there's different kinds. There's manual requisitions, which is one of the ones that we'll be using to practice. Okay, and there's computer requisitions, which of course are very nice and easy. You can scan those requisitions. So it just depends where you facility you're at, the type of requisition you'll be handling. Many times those little there's papers with a bunch of stickers. Those stickers are the requisition. Okay, somebody in the office has already inputted all their information. Okay, now your job is to still go ahead and verify the information of the patient, their name, full name, spoken name, their date of birth, okay, and perhaps another type of identifying information like using the bracelet, and of course the patient stating their name. All right. So there's barcode requisitions, which are also widely used now in almost every other facility. Okay. So make sure that you have receipt of the test request. Okay. Whatever tests you're going to be ordered are also on the barcode requisitions. So you look out for the type of test that you'll be needing to collect. Okay. So review it um, completely. Check to see that all required information is present and complete. That is your job. Verify the test to be collected in time and the date collection. Again, many times patients just show up just because the doctor gave them the script. They assume that blood needs to be collected that same day. It may not be the case, especially if the labs require fasting status. All right. Determine test status or collection priority. Again, does it need to be done stat, meaning right now, right away, or does it have to be done at a specific day, at a specific time? Again, this is your job. Okay. Now the next step is to accession the test request. What does it mean? It means the process of recording in the order received. Okay, the process of recording in the order received. So in the lab, especially in high traffic laboratories like the hospitals, you have hundreds of lab orders coming in on a daily basis. How do you start? Where do you start? Again, you have to prioritize them. Stats always go first. Okay, so you have to accession them and put them in the order and that they are received, but then prioritize them in the order they need to be collected. Okay, so that is called accessioning. Okay, be organized. Okay, accession the specimen needs to take a step to unmistakably connect the specimen and the accompanying paperwork with a specific individual. Okay, so when an order comes into the lab, you have to make sure that it is identifiable either by a specific number, using a specific number to that specific patient. It is assigned a unique number to make sure that that specimen always follows the patient. All right. Many times there's more than one specimen that you'll be collecting. So those numbers have to follow that patient. Okay. That's one of the safety measures that are used in the hospital to make sure that there's no errors during the accessioning. Okay. This also helps to ensure prompt and accurate processing from receipt of the order to reporting of the test results. Okay. So we kind of have a time frame that we need to keep up with, right? If you order the doctor orders labs at, let's say 9 in the morning, how soon, when did we get the order? Well, we got it at 9:05, okay? When did we go on collect? Well, it was collected at 10:15 and so on. And when were the results reported? Maybe at 11:30. So we got about 2 hours, which is actually pretty good for stat results, okay? Stat orders. Now this is a lab in the hospital, in the facility, okay? So things can happen very fast. Whereas outpatient labs usually take hours to collect and then to process and to report. Okay, so stat labs in the outpatient facilities are much slower than, of course, in the hospital. All right. So again, make sure that you have a requisition to be able to start the process. Okay, and make sure that the requisition is accessed or given a specific number. Okay, for the specimens to follow the patient. Very important. Right. That is step one. Now, step two, when you're going to approach the patient, okay, you're going to identify and prepare the patient for the procedure. All right. When you're going to approach the patient, take into consideration their situation. Why are they there? Have they been told bad news? Do they have a terminal illness or a serious diagnosis? Have they not been told? Okay. So we have to be somewhat empathetic with them, all right? That means putting yourself in their position. You have to understand that they're not there by choice. They're not there because they want to be there. They're there because they don't have a choice. Okay. So when you are going to approach the patient, make sure you look the part. Okay. You're a professional phlebotomist. You have to look the part. Okay. You have to also project the part. Remember when I said about body language, your body language says a lot. Okay. If you're not looking very happy, if your face doesn't show that you're maybe in a good mood or shows that you're not in a good mood, then you should be very conscious of it. Okay, when somebody tells you, I think you should smile a little bit more, guys, please take that as positive feedback and smile a little bit more. Be more relaxed in your work. Sometimes we get too tense and we reflect that to the patients. Okay, we show them that we're not really enjoying the work. I know it's something that you may not enjoy for sure, but at least when you're performing work, remember customer service goes a long ways. And a lot of patients do look for that. They want that, that special touch from the caregivers because they're in a dire situation, they're in a bad place, they don't know what to expect. And when we come in and we don't show a positive body language, well, that doesn't help any. So make sure you keep that in mind, right? Um, Before collecting the specimens, the phlebotomist should arrange the requisitions according to priority. We already know that, okay? So before you go into the room, make sure you're all prepared. Make sure you have your equipment. Say you're gonna visit Mr. John Doe. You get Mr. John Doe's requisitions and you look at him. He needs this lab, and this lab. Okay, three. Okay, very good. Okay, maybe take an extra one in case you miss the first time. Extra needles, extra tubes, gloves, sanitizer. Okay, remember your equipment is gonna stay outside, okay? So it doesn't look very organized when you have to go back and forth. So make sure that you do that. Okay. So you get everything prepared, your gauzes, your tape, and everything that you need. All right. Before you even approach the patient. That way you look like you're well prepared and you project that confidence in the patient. Right. If not, they're gonna look like, oh, he doesn't look like he knows what he's doing. Okay. So you don't want to feel that way. Okay. So make sure that you project that confidence. Okay. Look for any signs. Once you go into the door, okay, you're gonna lock the door and you're gonna allow yourself to be let in. Remember, don't just barge in there. Just because you're in the hospital doesn't mean that you have complete access to walk into the room. You have to make sure that you wait to be allowed to be let in, right? Look for any signs. When you walk in there, look in the walls. Usually they're gonna see some signs if there's any contraindications to punctures. They usually will say no venipunctures to the left arm, no venipunctures to the right arm, or whatever the reason. Make sure that you are aware of that, okay? But we'll take further steps as we'll discuss in a bit, okay, to ensure that we don't make errors like that. So look for any signs containing information concerning the patient's um, uh, is an important part of the approach, okay? Signs are typically posted on the doors or in the rooms or in the walls or behind the patient in the head of the bed. Signs indicating that there's infection control. Well, when you first, before you came in, hopefully you saw that yellow sign about infection control, okay, and you took your PPE, all right? Let's say this patient does not have any isolation precautions. So you walk into the room, okay, and look at the headboard, look at on the walls to see if there's any contraindications, right? Be aware of any do not resuscitate orders. Some patients that are DNR, they are in hospice. Sometimes they do not want any more venipunctures. So if you walk into a room and the family tells you, my family member he doesn't want any more blood drawn. You're like, oh, okay, I'm sorry. You apologize, excuse yourself, go communicate with the nurses and tell them, this family told me, is that correct? And they can clarify it for you, all right? Many times when the patient is already DNR, do not resuscitate, it means that they don't want any more needle sticks and IV therapies, no emergency measures, okay? So needle sticks will only cause pain, so therefore they choose not to have any more blood collected. So make sure that you're aware of that, okay? But clarify it and communicate with the caregivers. All right. Let me see what else. Pictures are sometimes used in place of written warnings when their patient cannot communicate, either verbally or they have some kind of impairment, either cognitive or dementia or anything like that. Make sure you're aware that you see any pictures. Communicate, clarify with the nursing staff. Once you enter the patient's room, if the door's open, okay, again, always knock. So do not knock too hard, guys. Sometimes you may accidentally knock too hard. Believe it or not, when you knock too hard and somebody gets scared or startled, they can actually influence the blood results, okay? Chemicals are released into your body when you get startled or scared. So make sure that you don't knock too hard, just, normal. Be gentle then. Make sure that you always ensure their privacy. So you're gonna close the door behind you, all right? Pull a curtain if there's any curtains in there. Sometimes the door is the only thing, right? But you make sure that you ensure the patient's privacy. If there's a visitor in the room, you can ask the patient if they're okay with them staying in the room. Okay. Many times they may not. The visitors themselves may not want to see any needles getting stuck in their loved ones, so they may excuse themselves. But preferably with the patients, you want to clarify, make sure that it is their privacy, that they don't want any visitors or any people in the room when they're getting this blood collection. Sometimes we forget because we assume this is the family, so no big deal, right? But go ahead and clarify with the patient. Is it okay if they stay here during the procedure? Say yes or no. That's fine. It's up to the resident member. It is their right. Okay. You may encounter during your visit that there is a doctor in the room. If there is a doctor in the room, guys, please wait a few minutes. They don't take very long, as you know. Wait a minute and let the patient ask questions to the doctor. Give them their time, even if it's 2 minutes, 3 minutes, 5 minutes, whatever it is. Do not go in there and interrupt, because that's when the doctors take chance to escape. Okay, and that's the patient's time. Okay, so make sure that you don't do that. Whether it be a doctor or maybe somebody else like a clergy, a priest, a rabbi, or a pastor, if they're in there, they're spending time with the patient or a family member, just come back. All right, just excuse yourself and I'll be right back. Go do another patient. You don't necessarily have to do that patient, that maybe that you do have to, but and you get the point. All right, do not interrupt them during time, because the visitors don't have a lot of time to go, throughout the day. And when they do, the last thing we need is for us to feel like they're rushing them, because we have to go in there. Remember, we are on their time. Okay, the work that we're getting paid for is under their time, not our time. So make sure that you don't interrupt any personal times like that. All right. So make sure that you're also aware about the priority of the exams or the labs. All right. I mentioned stat a few times, and it means immediately. So when a doctor adds orders stat labs, it means that they need to be done right now. Okay, not later when you have time, when you're done with this floor, with this unit. No, it has to be done immediately. So you drop what you're doing, finish what you're doing, and then go collect. All right. So if your job is to do floor A and floor B, okay? And when you're in floor A and then you got to do a stat in floor B, obviously you have to stop doing what you're doing in floor A and go to the next one, okay? Medical emergencies, obviously in the emergency room, if you're assigned to that area, obviously you have to go there right away. Time tests are also very critical. These time tests are done usually for therapeutic medications. So if we tell you, you have to be there by 10, make sure you're there a little bit before 10, okay? Don't show up at 10:30. It's too late. Medication has already been administered, and you just cause delay in the treatment of the patient. All right, so it's really important that you follow the time test. ASAP, as soon as possible. Test results are needed soon to respond to a serious situation, but sometimes it can wait a little bit. Okay, it's not critical like the stat ones. Fasting specimens, obviously, more so done in the doctor's clinics when the patients come in for blood work. They have to be coming fasting, so you want to get to them as soon as you can, right? Assuming that you don't have any stats, ASAPs, or time tests, you can do those fasting ones right away. You don't want to keep somebody starving unnecessarily. Now, fasting means no food or no food, only water. They can drink all the water, right? But no food within the last 8 to 12 hours. That is considered fasting, right? Now, NPO means nothing by mouth. You don't necessarily have to have patients NPO, right? It just means fasting. Usually that's what we require. We don't really necessarily. Post-op blood work is many times done, okay? After somebody has a procedure and the doctor wants to know how their body is adapting to the stress that was caused by the procedure, they will order lab work. Usually it's done every morning, okay? Sometimes patients don't understand that the response that your body's gonna have to the procedures or whatever it is that they're having done, can cause significant changes in your blood work. So that's why it's important. Okay, so if the patient asks you, well, oh, why you're here again, you just draw blood yesterday, that I don't. Well, it isn't your job. It is not in your scope of practice to explain why. Okay, if they have questions like that, you need to refer them to the nurse, okay, or to the doctor. But it's not your job to be explaining them, well, this lab is done because your body just went through a lot of medical stress, and that's not your job, guys. Okay, so make sure that you leave that for the nurses or for the doctors to deal with. All right. If a patient is unavailable, again, you can't find the patient. Maybe maybe they're in the restroom. Okay, most laboratories will have you fill out a form or document. Okay, where the patient was, or that you informed the nurse or the doctor about them. Okay, you can't just walk out and say, well, I'm sorry, the patient's not here. We'll come back. No, you have to make sure that you document that form, complete it, okay? Request the time and the reason uh, what you did, okay? And of course, always get somebody's name. You know, Nurse Jane Doe was informed of the patient up there, okay? Say the patient was in, I don't know, having a procedure done. Okay, so it's important that you always document, all right? Now, once you're in the room, okay, you already go in, there's no visitors, there's no family, you're pretty much ready to go. You have to make sure that you identify yourself as a student phlebotomist right now, okay? Once you pass your certification, then you're not a student anymore, okay? You're gonna introduce yourself in the beginning as a student phlebotomist. You're gonna say something to this, like, good morning, sir, my name is Javier. I'm a student phlebotomist, I'm here from the lab, and I'm here to collect blood specimens. All right, so you identify yourself, you tell them where they're from and what you're there to do. All right. From there, it could go off in any direction. Okay. So I've identified myself. Okay. The patient says, okay, nice to meet you, Javier. How are you? Very good. You have to obtain consent. We talked about this in the previous chapter, right? We have informed consent. Okay. We have implied consent. Okay. So you make sure that you obtain consent from the patient, that they're agreeing for the procedure. Okay. Very, very important. The patient's consent must always be obtained before starting the venipuncture. Always ask the patient for permission to collect the specimen, okay? After you identify yourself, all right? It's not just the right thing to do, but it's legally required. Remember, if you don't get consent, then you're technically legal. You're responsible for assault and battery, okay? They don't always have to state it verbally, but if they implied with their actions, like putting out their arm, that's implied consent, okay? They may not say anything, but like, there's my arm. That's implied consent. Okay, that would be good enough. But you must never collect a blood specimen without the permission or against their will. Again, don't try to convince them. That's not their job. Okay. Be aware of conflicting permissions. Okay, like, yeah, here's my arm, but do I really have to? That means they're not sure. So you make sure you clarify that consent. Ma'am, I do need to know if you're yes or a no. Okay, and that they're just making sure that communication is clear. All right, the patient is not sure of having the procedure done. Right, bedside manners, your behavior. How do you behave with the patient? Now, remember, these patients can scan you from the moment you come into the room. They're going to look at you from head to toe. You know, is your hair done well? Is your makeup done correctly? You know, maybe you overdid your makeup, right? Maybe you have, you know, big eyelashes like this, or you have acrylic nails, you know, like fangs. They're gonna look at you. They're gonna look at your clothes. You know, are you looking professional? Is your uniform dirty? Is it stained? Do you have crumbs on you? If they're looking at all these things, right? And they're reading you and they're like judging you. Believe it or not, like it or not, they do that. We all do that at some point, right? So they look at you and how you behave with them. You know, be very professional. Be very you know, keep your job, you know, and your personal life separate. Okay, they might ask you questions about, you know, are you married? Are you like, you know, hold on. Let's focus on the task at hand about the venipuncture procedure. Okay, but never discuss your personal life with them. Okay, approaching the patient is more than simply calling and up, you know, into the blood drawing, right, into going into the room. Okay, the manner in which you approach and interact with the patient sets the stage for whether or not the patient perceives you as professional. Okay, so it's very important that you set that right from the beginning. Okay, by the way you talk to them, the way you dress. Okay, you've already set what's called the trust. Okay, a trusting relationship because you look the part and you're talking professional, so you are behaving like the part. So it's really important that you do that. Okay, if you don't, some people may refuse, and they won't tell you they were refusing because the way you look. They're just like, no, I don't want the procedure done, right? And later they'll show somebody else like, person didn't look very professional. I don't trust them. Okay, but they didn't tell you, but that's what they were saying. They meant it. Okay, so again, first step is what? Make sure you access, right? Get the requisition and access requisition. Then second step is to approach the patient. And we discuss all these small things that matter, okay? Because that's what's going to establish the not the reputation, but the relationship between you and the patient at that particular moment. All right, even if it's just for a very short while. Excuse me. The patient identification, and we talked also about this before. when you're going to identify a patient, we need at least two identifiers, right? As per Joint Commission requirements, two identifiers, and it has to be involved. You have to involve the patient. They have to tell you, my name is, my date of birth is, okay? And you're using the bracelet, their name bracelet, and you're like, okay, okay. And then your requisition, okay, very good. It matches, your requisition matches the ID band, and they just stated their name and date of birth. That's great, okay? It's really, really important. The process of verifying a patient's identity is the most important step in specimen collection, guys. Very, very important. If you don't get the step right, everything goes down the drain, right? We can have serious complications because of this. So patient ID is the most important step, right? Because it can have severe, right, fatal consequences. The name and date of birth, again, it's a CLSI guideline GP33, okay, accuracy in patient and sample identification, right? Remember CLSI, one of the organizations gives us pretty much the whole Bible for the lab, especially in the venipuncture procedure, okay? CLSI is the one that gives us this. You have to verify their name and date of birth, okay? Check the bracelets. Again, I said the bracelets have to be on the patient. You cannot have an ID bracelet hanging from the IV pole, on the bed rail, okay? Or no, you can put it on the wrist, or sometimes they put them on the ankles. For some reason, you can't put it on the wrist, they can be on an ankle, okay? But you should never collect a specimen without a ID bracelet, okay? Because how did you identify this person to begin with? You can't, right? So it kind of checks and balances, okay? The ID bracelet, the stated name and date of birth, right? And your requisition helps you to positively identify this person. Very, very important. The patient's name, maybe EMR number, date of birth, okay, are very good. They are on the ID band. Their age is also there, okay? So it would be very difficult for you to get somebody that has the same name, somebody that has the same date of birth and same medical record number. That's not going to happen. So it's very important that you at least, compare the ID band with your requisition, all right? Protocols may vary slightly from healthcare institutions, but generally ID information such as the room number, bed number, and all that is on their ID band, okay? Now I said about, talked about through-way ID, okay? To avoid identification and mislabeling errors, some inpatient facilities require what is called three-way ID, in which the patient is identified by three means. Number one, the patient's verbal ID statement. My name is Javier, right? My date of birth is this. The ID band, that's number two, and the visual comparison of the labeled specimen. So after you collected your specimen, you put the label on the tube and you ask them, is this you? And the patient will say, yeah, they look at this, oh yeah, that's my name, yeah. So you verified them, okay? They're spoken, their ID band, and now you're showing them their tube. It's part of the identification process, guys. If you can do this every single time, you will never have any problems. But if you forget, or you're in such a hurry, I'm gonna go ahead and label it outside. Things can happen. All right, things happen. You're gonna forget. You might mislabel the specimen, and you're wondering like, oh my goodness, did I do this correctly? Did I put it on the right? So you can avoid all that by simply doing this three-way ID method. Okay. If there's any discrepancies in the name, MR number on the ID band, there's just not a match. You have to make sure that you clear that up before. You can have Maria S. Hernandez, Maria G. Hernandez. Which one is it? That has to be cleared up. Okay, sometimes patients will tell you, that's not me. I am Maria G. Hernandez, not Maria S. Hernandez. Okay, so you make sure that you clarify that before anything, right? There's no ID band, again, on either the wrist. As a patient, if you can check to see if it's on an ankle, okay? But anywhere else is not acceptable. You should not be collecting specimens if there's missing IDs. Either be on the wrist or has to be an ankle. Never verify information from an ID band that is not attached to the patient, or collect a specimen from an inpatient who is not wearing an ID band. You cannot do that. Again, inpatient. If they come in to your lab from their homes, that's different, okay? In rare cases, such as a patient with severe burns, the ID is left off intentionally, right, because they're burned. Follow facility protocol, which typically involves a verbal statement of ID by the patient and confirmation by ID by somebody else, okay? If they cannot have an ID band for whatever reason, then the patient's verbal statement and confirmation with another healthcare provider should be enough. All right. So again, when identifying someone, make sure they tell you their name. Okay. Never say, for example, are you Mrs. Smith? No. A person who is very ill, hard of hearing may say yes or not yes or no. Okay. So avoid that. They have to say it. Okay. They have to say it. Sleeping patients, when you walk into the patient room after you knocked, right, and nobody answers, do not too hard and don't go in there and scare them again. If you scare them again, it may affect their blood results. So make sure that you don't do that. Never attempt to collect a blood specimen from a sleeping patient. If you try to poke them without telling them they're not awake, what happens? They're going to jerk their arm and you might get punctured. And of course, that would actually be assault and battery. Okay. You cannot puncture someone, surprise them, right? That would be totally illegal. Unconscious patients. Now, there's patients that are in coma, all right? Doesn't mean they're dead. They cannot respond. Sometimes they're artificially placed in a coma because of trauma. The doctors need their body to rest. Okay, so they put them in artificially coma, but they can feel. So you have to explain everything to them, just like you were talking to them. They just like they were awake. All right, make sure that you explain everything. Tell them what you're doing. Okay, so they can expect it. Never tell them it's never going to hurt. Okay, you always tell them it's going to hurt a little bit. I'm going to keep it to the minimum. Make sure that they understand that. Okay, never tell them it's not going to hurt. All right. Now, emergency room ID procedures. Uh, Many times, some of these patients come unconscious, right? And traumas, car accidents, and so on. There's no time for identification, all right? So what the emergency room does is it assigns a temporary number to the patient, and that's what you're going to be using, a temporary number. It may say John Doe, Jane Doe, and their temporary number, all right? That's what you're going to be using. Fill out labels by hand or computer and apply them to the test request with that specific number. Okay, usually they actually give them a bracelet with a number. All right, so that's what you're going to be using to your specimens. Okay, attach an ID band or device to the patient that has a name. If you're going to be collecting blood specimens for type and cross, which means to determine the type of blood they have, you have to make sure that that you get that number. You're going to have to give them a what they call a bracelet. Okay, like the one shown in the book on page 218. That bracelet is going to stay with them. Okay, that number, and that's where the specimen, that's the number the specimens are going to be getting. Because type and cross, guys, is considered a special collection, and you have to follow a different protocol. So we'll talk about that later. Okay. Again, never collect a specimen without some way to positively connect that specimen to the patient. Very, very important. Especially it has to be with a blood bank. They're going to be getting transfusions. You have to make sure that you have the right patient with the right number. Remember, these are patients that are unconscious or in a coma. Young, mentally incompetent, or non-English speaking patients, again, you're going to have to find a way to identify them. If they're young, obviously they cannot give you consent, all right? So you have to make sure that you get somebody with consent. Now, if this is a young person, maybe a minor, 15-year-old, they come in because they were in an accident and parents are nowhere to be found. Sometimes the judges, the doctors are actually going to be the ones to give permission because they coming in here with implied consent. That means they want treatment, and the doctor will be the one to give the treatment or the authority to collect blood specimens on the patients. Newborns, obviously infants, they all look kind of the same, right? Little babies. You can't tell one from the other, especially if there are more than one baby. There's special protocols for that. Baby Martinez A, baby Martinez B, and so on. There's special protocols for that so that we don't confuse them. ID bands may be placed usually on the lower leg, okay, instead of the arm for kids under 2 years old. The nurse or a relative will identify the baby, okay? I don't know how they do it. To me, they all look the same. But the name and relationship of a relative, like mom, how do they call it? Baby Martinez, and then usually they give the same ID bracelet to the mom and to the babies so that they match, okay? The name and relationship of a relative, a guardian, or the name and title of a nurse who identifies the child should be recorded on the requisition. So when you're going to collect your specimen from a baby, an infant, like a brand new baby, you have to make sure that you document someone that helped you identify the baby, either the mom, the dad, or the nurse. Okay, and that's just to protect yourself to make sure that you do have the right patient, in this case, a newborn. Okay, and that you verified it with somebody else, since the babies cannot tell you their name, obviously. So the name and date of birth of the baby are, is it a boy or girl? The gender has to be told. Their medical record number or whatever number they give them, if it's more than one baby, and the mother's last name or the person that provided at registration, whoever the mom is or father. Multiple births present an increased risk of identification error, so you have to follow strict facility protocol when there's more than one baby. Very high risk of making an error. All right, so what do you do when patients come in from outside? Okay, they're coming in from their home. The doctor sent them in to get some blood specimens collected. Um, Usually, the receptionists will be the ones to identify these patients. They have to show their ID, right? They come up at the front desk, and the receptionist will ask for their ID, and she records all that information. Okay, usually that's done for us. But does that mean you don't have to do it? Yeah, of course you have to. Okay, every time you're going to receive a patient from from the lobby, you have to make sure that you define correctly. Remember, there's a lot of older people that are hard of hearing, and if they hear something, where they believe that you're calling them, and you ask them, "Are you Mr. Smith?" and they'll just nod yes. They don't even know what you're asking, but they may just nod yes. And you're like, "Oh, okay, well, come on in, Mr. Smith." Okay, and you send him back, and then a patient comes back in and says, "I haven't been called in. I've been waiting for an hour. What is your name?" I'm Mr. Smith. I was out there in the restroom. I'm like, "Oh my goodness, what happened?" You accidentally got the wrong patient. Okay, so again, just because somebody else already identified them with, doesn't mean that you don't have to do it anymore. You still have to follow that. Okay. Um, when they come into the outpatient clinic, okay, they may not have an ID bracelet like the one in the hospitals. They may be given a card, okay, a temporary card that will help you identify that person. Okay, so make sure that you continue on again asking their name and date of birth and whatever else you need to collect. Preparing the patient. You have to explain the procedure to the patient, all right? Explain what you're there to do, where they're going to do the procedure done, okay? And make sure they understand. Most people have some kind of blood work done at some point in their life, but if not, you have to make sure that you tell them, your intent to collect a specimen and what's going to happen. You can put a needle and you get some blood samples and it's going to hurt a little bit. So you make sure you explain it. Again, patient does not speak or understand English, you may have to use other means of explanation. Maybe you might need and somebody else that can explain it for you. Okay, your Spanish is not that good. Okay, this spells an interpreter has to be located. Patients do have the right to have an interpreter. All right, just because we don't speak their language doesn't mean that's it. You have to they have to find an interpreter for them. Usually here in the valley we're the interpreters. All right. Um, Regardless of difficulties involved, you must always determine that the patient understands what is about to take place. All right. Obtain permission before proceeding. This is part of informed consent. All right. You told the patient what you're going to be doing, and they agree, and they put out their arm. They've been informed. Okay. Now, what if the patient has questions? Well, why do I need so much blood work done? Why do we need it to be done? Again, those questions are to be relayed to their primary caregiver, either be the nurse or the doctors. Okay, it's not your job to be explaining anything about the lab work that's going to be done. That is not in your scope of practice. Okay. Now, if they refuse again, just because they refuse doesn't mean they're refusing because they don't want it. They may refuse because they have questions or other things. So if they refuse, please go out and tell someone. Call the nurse. Hey, you know what? Your patient over here is refusing the blood draw. So usually the nurses will go in there and talk to the patients and clarify why is it that they're refusing. They may have a question that is not in your scope of practice to answer. and the nurse clarifies it. Okay, he's good now. You can go ahead and collect your specimen. See, something so simple can be clarified, right? When you communicate. So it's important to keep that line of communication open. Don't try to badger them or convince them, okay, into cooperating. Don't restrain them. Never restrain them. Never perform a procedure without the consent. Um, Handling difficult patients. If you're there and you look great, you look happy, you're trying to explain things to the patient, and you're the patient's just been difficult. Okay, uh, remember to put yourself in their position. They may be very stressed out, worried, concerned about other things. If they're, let's say, they're the only family provider, okay, they're the only provider for the family, and about um, they're concerned about finances at home, who's taking care of the house, who's doing this, when am I going to be able to go back to work. There's a lot of things that are going through the mind, guys. So please be empathetic, understand that this is not where they want to be, and you may not be their favorite person at particular time, but you can make a big difference just by showing some empathy and compassion. Okay, if you run into people that do not understand, they're cognitively impaired, they may have dementia, right? Or they're combative, they're fighting. Some patients may display unpredictable or sudden movements. They may jerk their arm, okay? Or behaviors could pose a danger to themselves or you. If they move and you might accidentally poke them with a needle, you need to have somebody to stand nearby, okay? At this point, some people may be needed to help you in collecting these specimens. Okay, make sure you have if somebody is combative, you definitely don't want to be collecting blood to that person. Okay, it's not a good idea. So they might have to probably be restrained if the physician approves it, or just no lab work at all. Okay, it's not worth the risk of you getting hit by a combative patient or getting injured or have a needle stick. It's just not worth it. So never position a potentially combative patient between yourself and the only exit. If someone is showing, aggression, make sure that you're closer to an exit. Okay, so you can make a quick getaway if it need be. Some patients are sometimes confused. They may be disoriented, or they just have poor memory because of dementias. Again, you're going to have to get a uh, permission from a family member. If there's no family members around, then the physician will be the one to give the permission. Patients that are maybe under the effects of alcohol or other drugs can also have mental problems. They may be combative. They may have having withdrawal symptoms. So these type of patients may sometimes have to be restrained for therapeutic purposes, only for blood collection. If they're a danger to themselves or to you, they're probably going to have to be restrained. Right? It's something that's not done very often. It's not recommended, but again, it's done only under severe situations. One last thing on uh, needles. Needles. Some people are very afraid of needles. Okay, it's a phobia. It's a severe fear of needles. When they see a needle, they might pass out. Okay, they may scream or whatever. If you are a new phlebotomist and you don't have a lot of experience with people that have fear needles, your best bet is to have someone more experienced perform this procedure. For sure, you want to do it when the person is laying down. Maybe they're resting. They're in the bed, so in case they do get dizzy, lightheaded, or they pass out, they're not going to fall. So you ensure their safety. Also, you want to make sure that you address this, you know, uh, before you start the procedure. Make sure you're aware of that. So, needle phobia is there's a medical term called melanophobia. All right, that is a medical term used So make sure that you get somebody more experienced if you've never done this before with people that have this extreme fear. It can be a severe situation. Serious complications can occur because of fear of needles. All right. So hold on. We are done with step one and step two. We will continue our conversation in the venipuncture procedure in the next section. Be with you shortly.